Hi, everyone, and thanks for joining us for another dialogue with ADA Advocacy. I'm Lisa Murdoch, the Senior Vice President of Advocacy for the American Diabetes Association. We're going to be talking today about a policy topic that's very important to getting and staying healthy. It's also a cornerstone to ADA's Health Equity Now platform, and that's nutrition. There are so many important discussions we can have about nutrition. This discussion is focusing on the policies that ADA is supporting to increase access to food. Today, we have some experts joining us who can cover what's happening in nutrition policy at the federal and state levels. Welcome, Matt Scott, Managing Director of Federal Government Affairs, and Christine Falabelle, Director of State Government Affairs, covering Western and Midwestern states. Thanks for joining us today, Christine and Matt.
Thanks for having me.
Absolutely. Before we dive in, I want to set the stage a little by saying that ADA has been advocating for increased access to nutritious foods for people with diabetes and prediabetes for a long time. Good nutrition can be key to preventing and delaying the onset of diabetes and to managing diabetes for those who have the disease. As a result of the pandemic, sadly, over the past 15 months, we've seen an increasing number of people experience food insecurity, many for the first time. ADA is leaning in to support policy options aimed at increasing access to nutritious foods. And we want to talk about those policies today. Matt, can you start us off by sharing an overview of what's happening or what the priorities are for nutrition at the federal level?
So right now, we are all about increased access to resources for people living with diabetes. And that comes in a few different forms. So one of our top priorities is increasing access to culturally relevant nutrition guidance for individuals living with diabetes. Right now, under current law, most, if not all, federal nutrition policy is designed with the intention of keeping healthy people healthy, which is a very laudable goal, but unfortunately, it ignores a significant portion of the population that has one or more chronic conditions like diabetes. So we're fighting to secure some federally driven nutrition guidance, which would be more tailored to the diabetes community and make sure that there is relevant information coming out that helps individuals manage their diabetes in a more proactive way. We're also working to expand access through some of the food assistance programs like SNAP and many of the other federal programs that also play into some of the state assistance programs. We can get into this a little bit more later, but on some of the successes that we've seen in recently passed legislation earlier this year, we're looking to build on expansions and increased access to SNAP and WIC and some of the other programs. And we're also looking to explore ways that we can use new and existing economic incentives to address the food desert and food swamp issues. So areas where there's an oversaturation of highly processed foods, there are really a lot of barriers to being able to access healthy and nutritious foods in a lot of different communities across the country. So we'd like to work with federal policymakers, local stakeholders as well to engage in some public-private partnerships to be able to bring more healthy fruits and vegetables into existing places within communities. So broad-based expansion of access to a lot of things is what we're focusing on right now.
Okay. That's a lot to unpack, but it sounds, going back to what you've recently been able to engage in, does that include the American Rescue Plan? Were there other pieces of other nutrition pieces in that legislation?
Yeah, there were actually some real good inclusions in the American Rescue Plan for the diabetes community and in nutrition across the board. There's a 15% increase in the maximum SNAP benefit, and there's an extension of that through the end of this fiscal year. That's something that we're really happy to see included. There's also an influx of $5 billion of funds to extend pandemic EBT benefits, another $25 million to facilitate online SNAP purchasing. So a lot of good funding mechanisms were included to really help continue access to health.
Great. So, I know you working closely with members of Congress on this. What do you expect to see over the next year or year and a half?
I think there are a lot of different opportunities that will come up. The annual appropriations process is one of the regulars that we tend to see. There are opportunities to increase federal nutrition subsidies and programs like community development block grants that are able to put resources directly into communities. There is also a lot of conversations around a childhood nutrition reauthorization, which is something that we are closely keeping an eye on. This is something that has been due for reauthorization for a few years now. So some of the conversations really seem to be going in the right direction. And oddly enough, the conversations around the president's priorities on infrastructure are also somewhere where we may be able to see some movement on nutrition policy through some of the human infrastructure sides of things that are getting discussed. So a lot of big opportunities for the next year and a half.
Okay, well, that's a good segue into the administration. Can you talk a little bit about what nutrition priorities you saw in the recent budget from the White House?
Sure. So, yeah, one of the, as we've kind of been talking about it a little bit with some of the progress that was made during the American Rescue Plan with expansion and extension of summer EBT benefits and pandemic EBT in general, the budget provides for a permanent extension of the summer EBT program that would impact all students that are on free or reduced lunch programs. Also proposes an expansion of eligible participants going into SNAP. So a lot of direct benefits there, but there's also been a proposal to create an advanced research project specifically designed for health, and one of the focuses the administration has included there is diabetes. Be additional resources going into that for research, but also research going into the benefits of nutrition. So really looking forward to seeing what comes out of that as well.
Awesome. Thank you. Thanks, Matt. This was all really helpful information. I want to turn it to Christine and talk about state legislatures who are also tackling this important policy issue. Christine, you work with state legislatures across the country, mostly in the Midwest or West. Nutrition has been a priority for you and your colleagues in the state government affairs team for ADA. What trends are you seeing in nutrition policy?
Yeah, thanks for the question, Lisa, and thanks for having me this morning. Our trends that we're seeing across the United States is really focusing on both prevention and health access to healthy foods. So more and more research is coming out than ever before, just how damaging added sugar is in the American diet. Something as innocuous as a regular soda can lead not only to increased incidence of prediabetes and later on down the line type 2 diabetes, but things like heart disease, of course, increased incidence of cavities and even cancer. So a lot of legislation we're seeing across the US is focusing on children and just providing things like water as the default beverage in restaurants, prevention, later on down the line to prevent those diseases, because these habits are formed really early in childhood. And once you're an adult, your habits are set in stone. But if we can pass policies to make these healthy choices easier for kids, especially, it could be really beneficial. We're seeing like in Illinois, a bill passed to actually study the harmful effects of sugar. And so focusing on sodas and candy and cookies and all that kind of stuff, but also health access. And so making sure that kids have the availability to get healthy breakfast and lunch in the school. So that's what we're seeing nationwide.
Yeah, that's so important. We just wanted to focus on policy that ends hunger and, as Matt said earlier, reduce food swamps and deserts. Can you talk a little bit about what other priorities there are in the nutrition space at the state level?
Yeah, so we're really focusing on making the healthy choice the easy choice. I'm sure you've heard that before in a lot of public health circles, but especially in children, they don't really have a lot of say in what they eat at home or at school. And so if the healthy choice like a default beverage campaign, for instance. We're following this in a lot of states and cities where at fast food restaurants, actually the default beverage in a kid's meal would be water instead of soda. And that's just a really easy swap that a lot of families probably don't even think about, but can really add up to make healthy change. And like Matt and you said, we also are trying to address hunger, trying to alleviate food deserts, supporting funding like in Minnesota for increased access to healthy fruits and vegetables in these areas where people don't have access to these types of foods. In New York and Hawaii, we're working on SNAP double bucks, where it increases your purchasing power for things like fruits and vegetables to hopefully incentivize people to eat more produce. And we really want, like I mentioned before, children to have access to healthy meals at school to really break down the barriers for kids that maybe can't afford breakfast or lunch. So getting rid of co-payments for lunches and requiring free breakfast and lunches in some states like Washington and Oregon.
If you had to pick one recent win that you wanted to highlight for our viewers, which bill would you want to highlight?
I think Illinois is really hitting it out of the ballpark this year. So they're focusing on the default kids beverage. Like I mentioned before, Illinois state legislature actually passed a bill, and it's to the governor right now, requiring water be the default beverage in all kids' meals at fast food restaurants. And they also passed a bill that is examining just the dangers of sugar, especially on children. And we're seeing these successful efforts in states like New Mexico, Ohio, Colorado. So that's a major win. But I think also the focus on school lunches in Washington and Oregon, they are making breakfast and lunch free for students. And I think that's doing a lot for health equity.
Great. Thank you both so much. Before we close out, we have time for a few questions. If you have questions, feel free to put them in the chat box. Okay, I don't see questions. So people can always, if you decide you have a question, you can leave a comment and ADA will respond. But thank you for joining us today for this dialogue with ADA Advocacy. Thank you, Christine and Matt. We'll be back soon with another dialogue. In the meantime, please be well and stay healthy.
Thank you.